Abortion is a very polarized subject because of how emotionally charged it can be. Unfortunately, within the abortion debate, there are a lot of myths being thrown around that greatly affect how someone may feel on the subject and also the choices they may make. This can lead to laws that restrict abortion or even cause it to become illegal in some places. In this video, we will talk about those myths and explain what the truth is. Some of the content may be triggering as we talk about rape and also show pictures of both photoshopped fake abortions in fetuses and real abortions in fetuses. One of the most basic abortion myths are that contraceptives like hormonal birth control and emergency contraception like the morning after pill cause abortions. That's totally false. The way that hormonal birth control and the morning after pill work is by releasing hormones that stop ovulation from occurring. It stops pregnancy by preventing the egg to be fertilized. And abortion is the removal of a fertilized egg that has grown, so obviously they aren't the same thing. On a related note, a lot of people think that instead of getting abortions, people should just use things like birth control, emergency contraception, condoms, spermicide. Of course, it's great to encourage people to use these things, and we do need to work on programs that help educate people on their options as far as birth control and make it more affordable and easier to get, but that only reduces the use of abortions and doesn't eliminate them. The reason being, no form of birth control, not even abstinence, is 100% effective. Even if you are using the pill, the condom, and the pull-out method together, sometimes the condom breaks or you forget to take a pill, or sometimes even when nothing goes wrong, pregnancy can still happen, and those people still may need an abortion. You may be wondering about the abstinence comment. We're usually told abstinence is 100% effective. The fact of the matter is, rape happens. Even if you're abstinent, sometimes something bad that you can't prevent happens, and you may need an abortion. Besides that, a lot of people don't realize that abstinence means different things to different people. Some people think that being abstinent includes anal sex or grinding genitals together. Anytime semen goes near the vulva, pregnancy is possible, and you don't need intercourse for that to happen. Thanks to incomplete sex education, a lot of people don't realize the risks. Some people think, for some reason, that legalizing abortion makes people more promiscuous, less likely to use abstinence or birth control, and will cause more abortions. Really, in every incidence where we've seen abortion legalized, and therefore there have been more education about it, and people actually talk about abortion and birth control methods, there usually were less unintended pregnancies, and people were having safer sex or no sex at all. Also, legalizing abortion reduces deaths and injury due to pregnancy, and likewise, banning abortion in no way makes it go away. It just makes deaths due to botched illegal abortions or attempts to induce a miscarriage much higher. It doesn't save anyone. Now on to myths that involve abortion directly. A lot of times pro-life advocates will show startling pictures of cut-up babies or tiny babies that can fit in the palm of your hand. There are no babies involved in abortion, and fetuses, embryos, and zygotes don't look anything like babies for the majority of the development. In the first trimester, it's not yet classed as a fetus and doesn't look very human. In fact, you probably couldn't pick out a human embryo from a line of elephant or dog embryos. This is how development goes. The count of weeks actually starts before ovulation and fertilization even occur, the day after your last period, which is usually about 2 weeks before fertilization actually occurs, is when the counting starts. This is because everyone's cycle is different, so there's no way to really tell when ovulation started. After the egg is fertilized, around week 3 it becomes a zygote, which then travels into the uterus and the cells start to divide. At 3 weeks, it just looks like a bunch of microscopic cells. At 4 weeks, it becomes a blastocyst, and it actually implants into the wall of the uterus. At about 5 weeks, it becomes an embryo. You can see a heart, spine, and beginning of a brain. The heart begins to beat with one chamber. The embryo at this stage is about the size of a tip of a pen. At week 6, you can see bumps that kind of resemble facial features and nubs that kind of resemble limbs. I think it looks like a dinosaur. According to a law in North Dakota, abortion is not possible after this week. Week 7 is when the brain and spinal cord continue growing, and lungs, liver, spleen, and kidneys begin to develop. The limbs look like paddles, and in size, it's a little bigger than the top of a pencil eraser. It doesn't even have a digestive system or look anything close to human, but in North Dakota, it is apparently worth more than a parent's choice. At 8 weeks, the digestive tract starts to form and eyes are visible. At 10 weeks, it's about half an inch long, and it begins to develop the eyelids to protect the eyes. It has fingers. At 11 weeks, genitals start to develop. The head still makes up half of its length, but the length is now about 2 inches. At 12 weeks, you're in the second trimester. You may start to show a little bit. It is about 2.5 inches. This will soon be the cutoff date for abortions in Arkansas. At 13 weeks, the fetus produces urine, which goes into the amniotic fluid. Tissue that will be bone begins to form around the head. Its bones are not yet fully developed, but in Arkansas, this fetus is more important than the parent's choice. At 14 weeks, the fetus is 3.5 inches, and you can see the genitals. At week 15, the skeleton starts to develop bones. At week 16, it's about 4.5 inches. At week 17, fat begins to store on the fetus. At week 18, the fetus can react to auditory stimuli and is about 5.5 inches long. At 19 weeks, the uterus in the fetus may form. At week 20, you may feel movement, and it's about 6 1/3 inches. Some states limit abortion to this stage. At 21 weeks, the fetus is able to swallow. There's no way it would survive outside of the womb, but it's more important than a parent's choice according to these laws. At 22 weeks, it begins to grow hair and is about 7.5 inches. At 23 weeks, fingerprints start to form. 24 weeks is really the earliest a fetus may possibly be viable, and this is the cutoff date for most abortion laws, except in the case of health issues. At this point, it is about 8 inches. In weeks 25 to 26, the fetus can respond to familiar sounds, and the fingernails are fully formed. It's about 9 inches. Even during this time, any fetus that is born will need intensive medical care. Only about half of them would make it, and many that do would have permanent disability. 27 weeks is the end of the second trimester, but the fetus still has a lot to do. It needs to open its eyes. It can feel pain. It needs to finish bone development, continue sexual development, practice breathing, and gain a lot of weight. At 37 weeks, the fetus is full term, and any time before that, if it is born, it may require a lot of extensive medical care. Any time an abortion is performed during the third trimester, it is usually due to the death of the fetus or a very extensive disability where it would not survive. At this point, it is usually a wanted baby, and refusing abortion, even forcing the parent to carry the dead fetus to term and go through delivery, which is what many abortion laws cause, is incredibly traumatic. A lot of times the parent may want to bury or cremate the remains and perform a funeral, as that can be very therapeutic to the type of trauma that they go through. Which brings me to my next myth, that people will wait until the last possible second for abortion just because they feel like it. There are many reasons why a person may not know they are pregnant until the second trimester. Spotting and bleeding that can be mistaken for a period can occur regularly during pregnancy. They may have irregular periods or even be taking birth control that causes them to skip their periods. They may not keep track of their periods and not notice. They may have been abused or raped and can be too afraid to consider abortion until now. They may have had trouble finding a clinic in their area. They may not have been able to find a pregnancy test. They may have had to hide this from abusive parents and just now found a ride. They may have had to raise funds. They may have had a bed sex education, so they didn't know what was going on their body. They may have been traveling and unable to find a clinic. They may be disabled and have trouble finding a doctor that will help them. They may have been conflicted and not know what to do. There are many reasons why people wait for pregnancy, and I've never heard of someone putting it off just because. Another reason why someone may not seek an abortion until it is too late is crisis pregnancy centers. These are clinics sometimes set up near Planned Parenthood clinics or other places that offer abortion and give out false information in an attempt to keep you from having an abortion. They may tell you it's too late, they may frighten you away with false propaganda, they may discourage you from using birth control, or even tell you you're not pregnant when you are. Another myth they like to spread around is that there's garbage bins somewhere filled with aborted fetuses. Really, what happens varies from place to place. Some embryos are frozen so that scientific research or medical training can be done. Some are donated for reproductive use, but usually all tissue is destroyed, just like every other form of medical waste, incineration. One of the scare tactics a lot of crisis pregnancy centers use is graphic photos and descriptions of abortions that are totally falsified. They also don't really tell you that there's multiple types of abortions available. The abortion pill is used in early abortions up to 9 weeks. You just take a pill at the clinic that has the hormone progestin that causes the uterine lining that the embryo is attached to break down. The second pill can be taken up to 3 days later. It contains misoprostol, which will cause some cramping and bleeding to flush out the embryo. You may have some large clotting, but may not even be able to see the embryo depending on what stage it's in. There rarely are any side effects. Most times some dizziness or nausea. Usually it's no worse than a period. For abortion medications, for abortions that need to be performed later than that, the most common is vacuum aspiration, which is used up to 16 weeks. You'll be given pain medication so you won't feel a thing. Just like in a pelvic exam, a speculum will be inserted into your vagina. Unlike a pelvic exam, dilators will be used to open your cervix, and a tube will be inserted into the uterus to gently empty it. Remember, from 9 weeks to 16 weeks, the fetus will be anywhere from 1/2 inch to 4.5 inches. From anything after 16 weeks, dilation and evacuation is usually what is used. This is pretty much identical to vacuum aspiration, although sometimes extra material may be removed, and it usually takes longer. After 20 weeks, the fetus is no longer small enough to come out of the cervix in one piece. It does have to be dismembered in the womb. A lot of people talk about late-term abortions or partial birth abortions. The fact of the matter is, most abortions occur before 12 weeks. 12% occur after, and only 1.5% occur after 20 weeks. When they do occur around that time, the fetus would most likely not be viable and be removed dead. And most of the times, they may have a severe disability that would cause them to die during the procedure or soon after birth, or the life of the parent is at risk. In the cases that the fetus would be born alive, a surgical instrument would pierce the skull and a tube suctions out the contents so it collapses and can be pulled out. A lot of people think that if a fetus could survive on its own, it shouldn't be aborted and rather delivered. But there are some problems with that. In a lot of cases, the fetus would need a lot of medical treatment, as it would be born premature and may have disabilities. Who pays for this expensive treatment? The person who gave birth and doesn't want it, maybe because they couldn't afford it, or a prospective adopted parent, even though premature babies and disabled babies are less likely to be adopted than other healthy children. Or should it be the state? After later abortion procedures, you may have some bleeding and cramping. The spotting can last up to 6 weeks. It can take 4 to 8 weeks for menstruation to go back to normal. It's normal to pass clots as well. You really want to take it easy at first. If you have really heavy bleeding or severe pain or a fever, nausea, vomiting, or any other signs that you're not sure about, talk to your doctor. Abortion is one of the safest medical procedures out there, but there's always going to be some risk, which brings us on to our next group of myths, that abortion is incredibly dangerous. It's really not. As I said, it's one of the safest medical procedures available. Fertility is usually unchanged, especially in earlier abortions. Later term, especially if you have a bad doctor or an illegal abortion where things aren't as well regulated, there may be some problems with fertility because the cervix may have been hurt during the procedure. But earlier abortions and legal abortions usually don't have this problem. In fact, it's possible to get pregnant right after an abortion, which is something that a lot of people don't realize. There's no relation to cancer, and it definitely doesn't cause breast cancer. In fact, more people die yearly from pregnancy than abortion. Relatedly, a lot of people think that regret and depression are high after abortion, but that's really untrue. Although some people can have some trauma, there are places available that will help counsel. Usually, what people say they most feel is relieved. Another myth is that pregnancy isn't that big of a deal, so it's really not hard for the parent to just remain pregnant until they can adopt off the baby when it's born. This is so untrue. For one, pregnancy and childbirth are incredibly dangerous. According to the World Health Organization, one person dies every minute from complications during pregnancy or childbirth. Look at how long this video took, and just imagine that one person died every minute of it through childbirth and pregnancy. That's really important. Every 7 minutes, someone dies from an unsafe, illegal abortion, which is really important to think about that. Other problems that can occur include gestational diabetes, anemia, high blood pressure, hyperemesis gravidarum, placenta previa, preeclampsia, infection, and serious depression. It can all endanger your life during pregnancy. Pregnancy can come with all kinds of symptoms, not just morning sickness and cravings. It can come with fatigue, back pain, feet swelling, headaches, acid reflux, many more. Even if you do somehow avoid the major health issues that can occur, it can definitely keep you from performing a lot of the duties that you have to. It can keep you from working and get you fired when you absolutely cannot lose your job. If you do somehow make it to work despite the pain and vomiting, it's definitely hard on your body and can be hard on the fetus. It's also really expensive to be pregnant, going to the doctor and buying prenatal vitamins, as well as many more financial issues, especially if you lose your job. Many people physically or mentally can't sustain a pregnancy, and putting them through that can be physically or psychologically damaging. Also, adoption isn't always an option. Our adoption facilities are overcrowded. Many children end up growing up in foster care, bouncing from one person to another, or with no parental guidance at all. Disabled children, children who aren't white, children of certain ages, children of certain genders, and LGBTQIA+ children are much less likely to be adopted. We need to work on the issues our programs currently have before we rely on them. And of course, adoption is a substitute for raising a child. It's not a substitute for being pregnant. There's no such thing as a type of person who has an abortion. 1 in every 3 people able to get pregnant will have an abortion in their lifetime. 60% already have children. 16 are divorced, separated, or widowed. 83 are single. 43% are Protestant. 27 are Christian. 37% are Black. 34 are white. 22 are Latino. 33% are in their early 20s, and 17% are teenagers. These statistics and any information involved in this video were provided by medical organizations like the World Health Organization, and not by sources that were either pro-choice or pro-life. I hope that this has helped you understand what goes on during abortion and more about the abortion debate, and I hope that you can make decisions that will help protect people that can get pregnant. Thank you for listening. Bye.